Yeah, the clinical application. And just now we talk about the some herbs function and the basement, and this time we'll talk about the clinical complication, and we'll introduce some lesions, examples of lesions, and it's how to use the ointment or some other forms of external herbs, and I'll tell you. The general principle is just 6 words. In Chinese version, it's 6 words. 干对干湿对湿. And then it's in English, when the rash is wet, take the form of liquid for the external use. When the rash is dry, take the form of solid of the external use. It's very simple, but it's the general principles. Yeah. Wet. And wet. What is wet? Wet means the weather wet is humid, but in our body wet means you can see the water exudation on the face of the skin, then that's a kind of wet. And under the skin, maybe you have seen the wheel hives. That's that's under the skin. That's a kind of water, wet. And we'll give you some example. That's swelling. That's swelling. That's it's red and it's 粗，比平常的肢体要粗一些，所以它是一个肿胀的状态。Yeah, that's enlarged than the normal situation. That means swelling. Yeah. And the other example, it's that's the face, is the left cheek of an old woman. That's maybe in the redness in the red cheek, and it's swelling. It's swelling. That's a kind of wet. Wheals. I mentioned the wheals is the under the skin. The water is under the skin, so it's not vesicle. It's not vesicle. It's not in the epidermis, so it's in the dermis. So you can see the wheals. And if you scrub your skin, you can see a line swelling like wheals. That's another kind of wheals. That's all the wheals. Then you see this 4 lines. That's wheals. I have a story. A man tell the persons around him that I can write words in my skin. Yeah, that's she's got the wheals, and he's suffering the wheals. And we know the rules that he cheat, but so many others don't know about this. Oh, she's 神人. But she's a patient. She's a patient. Yeah. That's a kind of wheals. That's a kind of wet. And then wheals. And we can say 皮肤 and skin. That's 2 words. And you can write in your skin. Yeah. That's 非典, very famous condition. Yeah. Very severe problems in famous world. Yeah. All over the world. That's vesicles. Vesicle is a kind of wet. That the upper picture is the vesicle with some bleeding, and the upper one, the lower one is with the purple vesicles. That's with some bleeding, and that's all vesicles. That's all wet. So you meet that problem. You use the decoction or wash or wet wrap, because it's wet. Due to it's wet. So I think it's simple, but you must keep in your mind that's wet. And that's vesicles. And that's the large vesicles means bullous. That's the patient with the contact dermatitis. The plant of qianma or paints. That's the strong allergen when you have the feature tends to allergic. When you touch this kind of material, you got this one, the severe situation, and got the bullous. The way to this kind of condition, don't use the finger to make the bullous broken, and you can only use the needle. 就是那种消毒的sterilized needle from the bottom to broke them just one hole, and mildly press the bullous to remove the water in the bullous, and then apply some 消毒剂怎么说 apply some 碘酒之类的 Yeah, antiseptic. Yeah, you can put some iodine. Yeah, iodine to prevent inspection. Yeah, that's okay. And then the better for you to use some herbal decoction, and to avoid another water to reduce, to 生出来，就是防止它产生更多的渗出，应该怎么说？ exudation. Yeah, to stop the exudation. That's the pustules. That's very young kids to get the 脓疱疮，怎么说来着？the lesions with the pustules, and the main lesion, the main rash is with the pustules, and that's in summer, very kids will got the 链球菌感染 strep 什么来着 blah blah yeah streptococcus yeah infectious streptococcus to get the condition that's very popular in summer, and I think it's simple, but you can't use any ointment on the lesion because it's wet. It's wet. That's exudation. That's in the that's very. And then that's the foot. That's the toes. What's the problem? The last one. Last view. That's with swelling, exudation, swelling, and then have some infection, I think, because it's have some 有一点点脓液 pus, yeah, with a little pus, yeah. That's wet or wet, and that's the exudation. You know the skin of this area is in this area is no epidermis, I think. It's no epidermis. That's area without any epidermis. And then the immersion. You know, when the foot in the water or in the river, or that will got this situation, that maybe tinea, that's a kind of tinea, got this situation. So if you see this, I think picture can describe than what I say. So I'll introduce some pictures to you. That's if you have the deep impression with the picture, you will keep the knowledge in your mind. So that's the deep impression picture. And then all the picture wet is that the solutions. So you can use decoctions. Then the decoction, you use the herbs. You cook the herbs to get the decoction. 金银花、野菊花、透骨草 that and 马齿苋 and 生地鱼。生地鱼 you can only use it in the exudation and acute lesions. Yeah. Others you can use choose 2 or 3 herbs to make a formula for your patients. And water. Besides decoction, we can use only water as a herb. When I have, my patients, the majority of my patients have the face problem. Then, at that time, any herb, they will sensitive. So you can only use water. What kind of water? Mineral water, not tap water. Not tap water. It's distilled or boiled water. That's okay. Mineral water or pure water in the bottles. That's safety. And you can put it in the refrigerator and take out and put the water on the cloth and maybe the face mask, the tissue, and then put them to the face. Or you can put it in the 化妆棉 cosmetic cotton. Cotton ball. Yeah, you can put it on the face and only use the water as a herb, cool water as a herb. That's okay. In the very severe condition, and only the herb you can use is water, no others. 金银花、野菊花may be sensitive, maybe irritate to the skin, very, very red, and it's maybe a little purple, and it's swelling so much. So you can only use mineral water. That's a solution. And when it's simple, for the dermatologist, it's simple way to solve the difficulty, to solve the obstacle, to overcome the obstacle. I don't think it's very difficult. If you acquire the knowledge, you can use you can produce your own way to solve the problem. Yeah. The Western medicine, they use so many corticosteroids. That's a very important medicine for the inflammatory skin and inflammatory lesions, and the consequence is corticosteroid dependent dermatitis with burning, with the red face and burning. And when they have worried and they have nervous, they have burning, red, very red, and they itching, so many uncomfortable. And I don't know, I can't recommend any product to you, but now I can recommend. 我不务正业了好久啊，就是looked up and watched some magazines, some cosmetic magazines, and know to Wikia and to Baidu and Google for the information about products of cosmetics, and know how to solve the problem. And when I attend some cosmetic meeting and some dermatologist meeting and the factory of pharmaceutical chemist cosmetics, and the brand, I watched in the discount chemistry, the 理肤泉, I don't know the English name, 理肤泉 and 薇姿雅漾. That's the very famous French brand of cosmetics just for the patients with skin condition. That's very good product for the patient, for the facial problem, for the patient with facial problems. And then I'll recommend to my patients, and I'll tell them how to protect, how to do the skin care, how to choose the suitable product for yourself. And that's, I think, maybe especially for the females, they can protect their skin correctly, and not just for looking younger, but for your healthy skin. Just it's important like the body skin care. It's the skin, the skin reflect the inside of your body. The meridian is all over your face, and your texture, 你的气色哈，就是你的那个 color of your face is healthy or unhealthy. We can use 视诊 and to diagnose what's your situation, what's your sleep, what your lifestyle is healthy or not. Yeah. That's in our hospital, in our department. That's the wet wrap. That's the steam spray. That's 就是个 instrument. From this hole, they can produce some steam to the face, then to soften the keratinocytes and to do some other therapy. That's the first step. And then all the above is wet, and now we contact the dry. What is dry? Red macules is the form of dry. This is eczema. It's just like a coin. just like a coin. It's the eczema have so many forms, have so many 形状 shapes, have so many shapes, and maybe acute, subacute, and chronic. That's a kind of subacute or chronic ones. That's in the forelimbs, in the arms and legs. That's it. And then these macules. I have a question. White or brown? White. White is the normal skin, or the brown is the normal skin.
For Chinese, it's brown. For Asians, it's yellow.
Why I ask this question? A friend of mine called me one day. Oh, I've got syphilis. No, 白癜风怎么说来着？叫 syphilis。vitiligo 是吧 ？Yeah. She told me she got vitiligo, and I asked her how long. She said, "Oh, a month." Oh, I think it's okay. Come to see me. And then when she come to see me, oh, it's opposite. No, it's opposite. The white part of his skin is his normal skin, and the pigment. And she got the pigmentational condition. Yeah, that's opposite. So.
Much easier to treat.
Is this ganban?
Yeah, it's ganban.
But ganban usually smaller area.
Maybe smaller, maybe larger. So at the very beginning, it's smaller, but it's larger and larger. And the patient don't know how to diagnose, how to judge where is the normal skin. And then she told me she went to the other hospital, and the doctor told her, you've got the vitiligos. Yeah. So I don't know why. Maybe the other doctor pay no attention, not watching. I don't know the reason. So I remember this example. I introduced this example to you. The purpose is to tell you to observe carefully. Yeah, which is the normal skin and which is the affected skin. Yeah. Papules. That's the upper one is the condition means 传染性软疣，它是一种that's 病毒感染。Yeah, virus. Yeah, by virus. That's a papule. That's a papule. Often happened in the suffered by children, kids. Yeah, virus. And the lower one is a very difficult condition. 结节性痒疹. That's very itching. It's very itching and maybe happened in the forelimbs and back, the upper back, shoulders. And then that's take the form of papules. The papules is the dry. The dry. Then the solution. To solve the dry, you can use the herbal ointment. Ointment is the very common used way for the lesions, for the subacute or chronic lesions. And then you can use the large beeswax Vaseline. That's you can put the herbs, put the powder of the herbs to the Vaseline or some creams from the factory. In China, we can purchase some base from the factory. Then you can do some ointment or cream yourself in your clinic. Yeah. In the break, somebody asked me where is the better, the raw herb or the granules for the external use. My suggestion is raw herbs, because the granule has some other materials in it, and the raw herb is 1%. So if you have the opportunity to produce some ointment, you should always use the raw herbs, and you can you can 把它打得很细啊，就是磨得比较细 ，grind them, yeah, grind them, yeah, and maybe you'd better use the 筛子怎么说 ？sieve, yeah, use that, and maybe 100 目、200目的那种细的筛子。I don't know how to say it in English. Yeah, the thinner the better. Yeah, the thinner the better. The raw herbs, you use raw herbs.
If we can't get any base into bases,
Yes.
can we just use any kind of cream pharmacy that has no color or no scent?
Yeah, you can use it. I don't know. You can purchase any base in Australia, but in China we can.
I mean, how about we just get some kind of just plain cream having no color, no scent?
Yeah. That's okay. Yeah, that's okay. Yeah, that's okay. But you may pay attention for the ingredient of the base, because for the oil skin you can't use any skin with the any base covered vitamin E, because vitamin E is rich in have the base rich in oil, so it's not suitable for the oil skin. Yeah, but for the dry skin or mixed skin. And then the herbal emulsion. Herbal emulsion, that's very thin, and you can combining herbal powder with water, oil, and emulsifier. If you can make it yourself, I think it's difficulty. Maybe in the one bottle of the producer, one bottle of emulsion, you should pay attention to the stability, 就是那种稳定性 stability of the emulsion, and you can purchase the emulsion without any fragrance, without any other herbs, and you can use that to be the base of your emulsion. Yeah.
How long do you decoct raw herbs for?
What?
How long would you decoct the raw herbs in liquid and then add to a cream, like 10 minutes, or would you grind into a powder and then add to the cream?
You mean when you make the?
Do you cook the raw herb first and then use that liquid?
No.
Mix in with the cream?
No, when you make the cream, you use the raw herbs.
You grind. You just
Grind,
dry
yeah,
it.
just grind raw herbs. Yeah, don't cook them. Yeah.
So what's the ratio, what's the portion of raw herbs and cream when you mix them together? Is it like 1-to-1?
No 1-to-1. Different herbs have the different 比例. Yeah, maybe it's maybe 10%, 5 to 10%.
Of the raw herbs?
Yeah, of the raw herbs, and it's up to the severity of the condition and the irritation of the herb, and then the irritation of the base. Yeah. And then herbal vinegar. That's very easier for you. It's simple for you to mixing the herbal powder in vinegar, but it's just like a wine. It's irritated to the skin. So when you apply herbal vinegar in the skin, you can only put it in the affected area. Yeah, soak area, and it's just in the hands, palm, or bottom of the feet. And if you use in the sensitive skin, that's worsen the lesions. So you must pay attention. You must keep it in your mind. Okay. That's okay. That's okay. But you may pay attention without any broken area. Yeah. That's okay. That's maybe the only way to solve the problem in the 头皮那个 in the head. Yeah. Head skin. Yeah. Herbal plaster. Herbal plaster you can apply herb on the on it. And when you are in the kitchen, you have some oil, very hot oil on your skin. I have the experience, and I put some plaster on the area, and the next morning that's okay. So I suggest you prepare some medicine or some plaster in your kitchen when you have suffered from this kind of condition. You have find a way to solve them.
Burning by oil?
Yeah, burning by hot oil.
Hot water?
The first you use the tap water to wash, and then you put some a plaster or some ointment or some other 就是那种特效的那种药，你要备一些。You should prepare for it to protect your skin. Yeah. 金蔓红. If you have the vesicle, don't use 金蔓红. You haven't got any vesicle, you can use 金蔓红. You remember the general principle? 干对干，湿对湿. You have the vesicle, that means wet. You can't use any ointment. You know? Okay? And then that's in addition, that's dry. That's the picture reminding dry. That's a patient with neurodermatitis. Neurodermatitis, that's the thin, dry lesions on the eyelid, on the eyelids. That's very itching, and it's when you have a mental heavy burden and you're worrying about something and you have nightmare and not good sleeping, and you will have this problem, have this I think it's maybe some patients told me, oh, doctor, I use some ointment for the eyes to use on my eyelid. I think that's okay, because that kind of base is suitable for skin. It's inside the skin, especially is outside the skin is not problem. But I don't like the function of the medicine in the ointment. But the base is suitable. If the ingredients is suitable, that's okay. So eye ointment can be used in the skin, especially for the eyelids. You can choose some eye ointment to be the solution of some lesions around the eyes. Yeah, you can use some, and especially for the other sensitive parts. Yeah, just like other parts of the body, and you can use the eye ointments. Yeah, that the ointment for eyes can choose the correct compositions and quickly improving. If the ointment have some steroids, don't mention it. You can use not more than 5 days. That's okay. That don't produce the steroid dependent dermatitis. Not such a long time. Less than 5 days. You have to tell the patients if 3 days the problem is solved, that don't use it anymore. If 3 days is not enough, 5 days. Not 5 days. 5 days is not enough. Please stop. And then from the 8 days you can use it. Yes. So the principle is very important. Steroids don't. You can use it. Majority of eye ointment have steroids. Yeah. But don't mention it. That's lichenification. Lichenification is the two images is neurodermatitis. That's very common in the big company working for their staffs working in the office all day and overnights and overwork, so they have mental heavy burden. That's common, very common in their prior necks and in the elbow. Yeah, that's common parts of the body which suffered from this kind of condition. It's itching, but you can use some. That's dry lesion, so you can use ointment, emulsion, and even tincture and even vinegar to solve the problem, because it's very thin. It's not the sensitive part of the body, and have the better toilet. Yeah, that's the very thin lesions in the elbow and the hands. That's psoriasis. Yeah, that's psoriasis with the junction changed. Yeah. The nail. Yeah, the nail problem. That's psoriasis. That's typical symptoms of psoriasis. Okay. That's dry lesions. Fissures. Yeah, that's the bottom. 足根部应该怎么说？忘了。I don't know. Heel. Yeah, heels. That's the heels. And then that's the tinea on the hands. So if you meet the problem, the patient with that problem, you can use, you diagnose the first, that's dry. That's dry. And you can use ointment, cream, emulsion, and even tincture and vinegar to solve the problem. It depends on the patient's tolerance. Yeah. A different location, and they have the different of the tolerance. Solution. The base is Vaseline. You know why we use the Vaseline? Because it's the first is not very expensive. It's very cheap, and it's easy to get. And then it's oily. You mean in the heels, that kind of location, you have the base oily, oil, rich in oil. So you can the location of the skin needs oil and moisture, water. So Vaseline can afford oil, and then other forms of just like emulsion or cream can take the moisture. So you can apply them to the affected areas with the thick layer. That means feet and hands and other non-sensitive part of the skin. You can use the this kind of solution, and it means dry. Dry. You remember the dry. No water, then you can use that. That's psoriasis vulgaris worsens. Nobody have the lesions like that at the first of the at the beginning. That's the later. That's the worsened patient. To use any wrong strong function ointment or other the incorrect external medication to that consequence. So if you have the psoriasis patient, do not use any strong function at the very beginning, and you can use some sensitive medication at first to avoid this kind of consequence. And to that consequence, we can only use one medication, Vaseline. Vaseline, only Vaseline, no other herbs in it, no other Western herbs and other ingredients in it, just Vaseline. No others are irritant. It's maybe irritant, so we can use only Vaseline.
Even though it's petroleum based, it's not even a natural.
Vaseline is the base, and is the ingredients. And if it's the lesions is better, and you can change other functional, effective herbs on it. So at first, you can only use that one. What?
Do you ever use lanolin? No, lanolin from
Yang. I haven't got any experience to use that lanolin. Yeah, only. I know it's very famous in Australia. When we go back to China as the gifts, yeah, as the gifts. I think maybe when you have a bath, you can use some goat soap. Goat soap. 山羊皂. Yeah, goat soap. A friend of mine told me that it's goat milk goat soap. Yeah, goat milk soap. Yeah. My friend told me that it moistures the skin, and her skin is moisture after he used the goat milk soap. So I think it's maybe it's helpful to moisture the dry skin. For me, it's what?
I wonder what formula you will use for the patient to take.
What?
喝的方剂应该是
Herbal. 哦，
他这个严重的情况之下，外用不行的话，要喝什么汤剂？
一般这个要看辩证，一般它是那种热毒型的，我们就是清热解毒，就像那种犀角地黄汤加减加一些清热解毒的药就可以，这个叫那种红皮病型的 psoriasis，And then that's the we can do some conclusion. When you afford the external formula to a patient, you must pay attention to that three parts. First, grasp the functions of the herbs. I introduced about more than 10 herbs. That's the majority of the external herbs. For the detail and more herbs, you study the books I mentioned above, and then you will learn more. And today I'll introduce the majority, the introduction. That's the very beginning to make you enter the gate of the external use. And then you choose the suitable forms. That means you choose the suitable base. The base, I introduce about 7 to 8 bases.